friends. Since the time I have joined yoga, since the time I've started teaching, the number of people that have approached me for all age groups is mostly for two reasons. One is weight loss, and the second most important is the back pain. And that is what I'm going to talk about today, the back pain. I'll be dividing the videos in two parts. One, I will talk about acute back pain, and tomorrow's video I will talk about chronic back pain. It is not necessary that people having chronic will not have acute. Okay, and chronic and acute back pain also can lead to a long term, which is a chronic back pain. But today's will be specially for acute back pain. I will be showing you certain postures, certain asanas that you can do, which actually will not even take more than half an hour. At the end of the video, I will also be talking about a few tips that you can use to relieve the pain, to ease out the pain, and come out of the pain quickly. Okay, so let's begin. The first thing that I will be showing you, and which you have to do, especially when you have acute pain, like you're being crippled, you can't do anything, you can't sit, you can't stand, and you can't lie down for a long time. Okay, the first thing that you will do is lie down on your belly and go into Makarasana. I will show you how. Makar is crocodile. So in English, it is a crocodile pose. This will relieve your pain to a large extent, and it will, just help you in coming back to your normal routine. Okay, the first thing that you will do is lie on your belly. Of course, lying on your belly doesn't mean that you will be lying on the floor. You have to lie on you have to lie on the floor and not on the bed. If you think that you cannot absolutely sit down, only in that case you take the bed. But otherwise, floor is always preferable. What you do is you keep your legs apart, approximately 2 feet or 1.5 feet apart, and you see to it that your toes are pointing outwards. Your toes are pointing outwards. And then you make a pillow of your hand and rest your forehead on the wrist or palm. You will lie down like this till the time you feel comfortable. I am sure within few minutes you will feel that your pain is easing out, you're able to do further, you're able to stand up and do something else. Till that time you will lie down. So that is why there is no particular time limit. You can choose your time till the time you feel your muscles are relaxed and you don't feel the pain as much. Okay, you will not get 100% cure out of it, but you will be able to do your daily activities. Otherwise, 1 minute to 3 minutes is perfectly fine if you lie down like this. So this is the Makarasana. Again, your toes are pointing outward, both the toes are pointing outwards. Choose your comfortable level, choose the comfort level of your legs, how much apart you want them to be. And just rest your head on your wrist. Your neck and your spine will be in one straight line. Okay, you will not be seeing sidewards or bending down. Your spine and your neck in one straight line. Okay. After this, when you feel a little comfortable, what you're going to do is you're going to slowly get your legs together. Okay, ideally the legs are joined together. That means your heels together, knees together, thighs together. Okay, and from here you go into Kokilasana. Kokilasana is nothing but if you would have seen small young children playing, watching TV, you know how they do? They take their elbows forward, both the elbows forward, okay, and make a small cup with your palms and place your chin on the palm. Close your eyes and breathe. Now here there are two levels. If you forward you take, the easier the bend is. And the more towards your chest you take your elbows, the deeper the bend is. So you will choose your bend according to your comfort level. So if you think this is a deeper stretch and you can't take it anymore, just walk a little bit forward with your elbows, place your chin and then relax. The important thing here is to keep your legs relaxed, buttocks, lower back relaxed. Let it fall naturally into the floor. Let your muscles relax. Okay. After this, you're going to again come down into Makarasana and relax for 30 seconds. The Kokilasana that I showed you, this one, you can hold it again for 1 minute to 3 minutes depending on how you feel. Nothing less than 1 minute I'm telling you, because this is all therapy related, and if your muscles have to get the feel of what you're doing, if it has to get the the healing that you need, it requires at least 1 minute to begin with. After this, you're going to go into a Sphinx pose. For this, you will lay your entire forearm on the floor, okay, and legs together, and again gently look up. Be here again for 1 minute to 3 minutes. Now here the important part is you will close your eyes and you will breathe into your back. Consciously allow your muscles, the muscles of your back, the muscles of your sides to relax. Remember one more thing, that you're not taking your shoulder towards your ears. Your shoulders are away from your ear. Pull yourself above your head. Do not slouch. Just keep a comfortable bend. Again, you will hold this for 1 minute to 3 minutes. You will come down again in Makarasana and relax. Very well. So remember these three poses. First is Makarasana in acute pain. When you cannot do anything, you just go lie down in Makarasana. That is the crocodile pose. Slowly you lift yourself up to Kukilasana. And then rest. Then lift yourself up in Sphinx pose. And then rest. Now, beyond this, if you still think you're okay and you can continue, okay, then after this, you will again go into the Sphinx pose. Okay, relax here and slowly start lifting your legs up, both the legs towards your hips. Now here again, the more closer you take your heels towards your hips, the deeper the stretch. The more away, the more relaxed the stretch. So choose your power, choose your bend according to your comfort level. But remember, the shoulders, you're not slouching, they are above your ears, away from your ears, and just maintain this bend. Head towards the toes, toes towards the head. A very important thing to remember here is that you're not going to take any jerky movements. Remember, any jerky movements is going to worsen your condition. So the entire flow is very smooth even when you're getting both the legs up. Take control of your legs, take hold of your legs, use your glutes muscles to pull yourself up, to pull your legs up, and then maintain it. To go down, again, use the muscles of your glutes to take control and slowly, do not let them fall down. Okay, you're going to slowly take them down. After this, again you come down, Makarasana, relax. Okay. By this time, I am sure the back pain would have relieved quite some time. Okay, if you still think that it is not, just lie down in Makarasana and don't do anything for some time. After a while, after some time, you can just roll over very gently on the mat and lie on your back. Okay, after lying down on your back, you will feel that your back has undergone a lot of backward bend. So it might feel stiff. It might feel difficult to even lie down straight on the mat. That is absolutely okay. That is absolutely fine. You just need to adjust your spine to the ground now. How will you do that? You will fold your legs. Keep them approximately hip level apart. Your hands on the floor, palms facing down. Okay, and just push your spine slowly into the ground. You're pushing your spine into the ground, leaving no space even for the air to enter inside. This has to be completely stuck to the floor. And then slowly you relax. And again back, sticking it to the floor, pushing it to the ground, and relaxing. Why you're doing this is because you have undergone a little bit backward bend. Your spine needs to again come back to its normal position. So you're doing this to relax it. After this, you will go for one spinal twist. Okay. Again, as I said, if you think you're here, you're done, you cannot do it anymore, you are absolutely free to leave it here itself. Otherwise, one more spinal twist and then we will be done. For the spinal twist, you bring both your legs together, knees together, legs together, interlock your fingers, keep them under your head. Your neck is straight, you're looking up, your chin is straight. Okay? Very gently, you're going to drop both the knees to the left side. Okay? And just see how you feel here. Okay? If you think you cannot go beyond here, what you can do is you can use either a yoga mat, a yoga block here, just to rest both the legs on the yoga block. Either this way or this way, depending on how much you can do. Just rest your yoga block here and relax in this position. It is a spinal twist, a mild spinal twist. And center. For people who do not have a yoga block, can use something like cushions or towels. Here this side. And rest. Center to the other side. Again, both the sides, each side you have to maintain single, 1 minute. Okay. After this, you come down, you straighten your legs, you relax for 30 seconds. Inhale and exhale. And after this, what I'm going to show you is a very relaxing backward stretch to your back. Okay, this is a supported Kandharasana. That is a supported. Now, how you can support it? You can use a cushion. I'm using a lumbar cushion like this and placing it right at the lumbar region. Okay, the lower back is what we call. Now here, if you don't have anything like a lumbar cushion, a normal cushion would do. Otherwise, what everybody or we all have in our houses is the beach towel. So you can roll up a beach towel, something like this, place it again on the lumbar region, and very slowly use your hand to go back. Place your elbows down, and then finally put your shoulders on the floor. Now here you are the best judge of how much bend you're comfortable with. Remember, you're going to keep this bend for at least 3 minutes. So come in the most comfortable position. If you think this is very uncomfortable, you can do what you can do is place another cushion under your head. And now this will be very comfortable. Okay? Or you can reduce the length of the towel. And then lie down straight. Straighten both your legs. Open your palms to the ceiling. Come in the most comfortable position and relax here. Now I'm going to just give you a guided instruction of what you can guide yourself while you're lying down in this position. Close your eyes very gently. Let all the body parts relax. Relax your legs. Relax your buttocks. Relax your hands. Relax your shoulders. And now take your awareness to your back. Feel each and every muscle of your back, from your upper back, behind your shoulders, and slowly take your awareness down to the lumbar region, the middle back, and the lower back. Consciously let go of any stress, any negativity that you're holding here. Let it pass. Breathe into your spine now. When I say breathe into your spine, you're going to place your awareness on your vertebrae, on your spine. You're going to inhale into your spine. Exhale out of it. Inhale into your spine. Exhale out of it. You can do this for 3 minutes. Maintain this for at least 3 minutes. Depending on your level of your in-between. If you think that it is too stressful, again, just loosen it. Make it, reduce the length of the towel. After finishing 3 minutes, you can just take it out. Again, lie down straight. Fold your legs. Push your spine back into the floor. Relax. To come up here, this is where most of the people go wrong and use jerky movements is while coming up. The right way of coming up when you're lying down is you take your left or right arm, whichever you feel comfortable, above your head. Turn towards that side. So you are taking your left arm up, you turn to the left side. Fold your legs in the knees. Place it one over the other. Now your right arm is free to give you support to get up. Place your right palm on the floor. Push your right palm into the floor. Take the support of your right hand and slowly get up. Remember, this is the technique to get up for everybody, not only for people suffering from backache. The reason being, we are very less careful. We think that we might just get up. We don't know what pressure it places on the spine and which nerve probably might get stuck in between the vertebrae. So that is why it is very necessary to be very careful of how we get up from a sleeping position. Okay, the asana and the postures that I spoke to you about. Now I will be talking something about regarding the tips, what you should be doing in around if you have acute back pain. Okay, the first and the important part is you will stop all your strenuous activities that you have been doing. If you have been doing heavy running, marathon running, heavy walking, heavy aerobic exercises or gymming and all that, you will stop it for some time till the time you feel okay with all these. Secondly, you will do all these mild stretches that I've told you. You will do it daily, okay, without fail, daily for half an hour. It is just like a medicine that a doctor will recommend you. You will never say no to a doctor's prescription, right? So in the same way, you will not say no to all these stretches. Avoid wearing high heels for some period of time. And the other thing that you can do if you are in acute pain is the hot and cold fermentation for your back. We all know hot fermentation is the hot water bag or the gel pack that you keep it on the back when you are in pain or on your neck or in your back. It's the same thing. You will add a cold fermentation in the sense you will apply the hot fermentation for 3 minutes, cold fermentation for 5 minutes, and you will keep it applied 3 minutes, 5 minutes, alternate again 3 minutes, 5 minutes. Okay. If you think this is too tedious and you're alone and nobody can help you with this, you can just make hot fermentation is absolutely fine. Just lie down, put it on your back before sleeping. It will help you release your pain. The other thing is be very careful about how you sit down, the posture that you're sitting in, and you keep your back supported all the time. So if you're sitting on a sofa, firstly see to it that your sofa is not very soft. Sit on firm mattresses, sit on firm chairs, back supported with the lumbar pillow or cushions or whatever. Be very aware of how you are sitting. Most of the times, 99% of people of us are not aware of how we sit. Sometimes unconsciously, the the shoulder is bent on one side of the spine of the back is taking the maximum pressure, the pain. Okay, and slowly, and then you can do is your oil massages. There is something called as the Mahanarayan tail, which is there in Ayurvedic shops, the Indian Ayurvedic shops, which is you can use for massaging your back. Here you don't have to massage your back literally. You can just rub it on the surface. After rubbing on the surface, you can apply a flannel cloth. Flannel is apply the oil, apply the flannel blanket, and then keep the hot fermentation on your back. This will really help you with your pain. It will relieve your pain to quite a large extent. One is the Mahanarayan tail that I spoke about. Another is this that I have kept it here. This is the Madhivala lintment oil. This again is used for any kind of back pain, joint pains. So these are the two oils that I would recommend that you can apply. Once you're out of your acute back pain, then you can move forward to the chronic back pain exercises, and then slowly moving forward to strengthening your muscles of the back so that you never ever get into back pain. And last but very important and not the least is be positive. It is not a lifelong thing. Don't get bothered with it. People have come out of it and they have led very beautiful lives. That's it for today. Thank you, and I will see you